a family of four, no major health conditions, and they're paying over $1,600 a month for health insurance. And that's after they still get hit with a $382 bill just for a follow-up ultrasound. This isn't a story I'm making up. This is happening right now to real families across America. And what I found when I started digging into these numbers should terrify every single one of you. I'm Helen Morland, and if you've been following the Morland Report, you know I don't sugarcoat the healthcare crisis in this country. I've tracked 1,847 doctors who just quit. I've investigated insurance companies abandoning entire communities. I've documented 412 emergency rooms closing in just 14 months. But today, someone handed me a reality check that I need to share with all of you, and I need you to hear this because it connects every single dot I've been tracking. Before we go further, hit that subscribe button right now, because what I'm about to break down affects your family, your neighbors, and maybe even you in ways you haven't realized yet. This channel exists to expose what the healthcare system doesn't want you to see. And trust me, they really don't want you to see this. So here's how this story starts. There's a creator named JenX who runs a channel about moving from the US to Canada. She just posted a video sharing what her family pays for health insurance. And I'm going to be completely transparent with you. I'm giving her full credit because she did something most people are too afraid to do. She put actual numbers on the table, real costs, no hiding behind vague statements or political talking points, just raw financial truth. And when I saw those numbers, I knew I had to verify them, break them down, and show you exactly what's happening to American families. JenX and her husband are self-employed, family of four, no major health issues, just regular people trying to stay healthy and protected. And here's what they're paying. Before the recent insurance rate increases, they were paying $1,384.76 per month. That's over $16,000 a year just in premiums, just for the privilege of having insurance. Then the rates went up. Now they're paying $1,615.67 every single month. That's $19,388 a year in premiums alone, just for the privilege of having insurance. Then the rates went up. Now they're paying $1,615.67 every single month. That's $19,388 a year in premiums alone. But wait, because this is where it gets worse. That premium doesn't mean everything is covered, not even close. Regular doctor visits, $30 copay every time. Emergency room visit, $50 just to walk through the door. And that's before any treatment. And then there's the deductible, $1,750. That means after paying over $19,000 in premiums for the year, they still have to pay the first $1,750 of medical costs out of their own pocket before insurance even starts helping. Let me give you the example JenX shared, because this is where the system shows its true face. She gets yearly mammograms, smart, responsible, preventative care, first mammogram, $30 copay, but she has dense breast tissue, which makes it harder to see clearly on a mammogram. So her doctor, doing the right thing, orders a follow-up ultrasound, not treatment, not surgery, just another scan to make sure there's nothing dangerous hiding. She calls to schedule it, and the radiology place tells her the estimated out-of-pocket cost with her insurance is $382.84 for an ultrasound, a preventative screening that could literally save her life. And here's the kicker. They told her she has to pay that upfront with her credit card when she walks in. Maybe the insurance company reimburses her later, maybe they don't, but she has to come up with almost $400 on the spot for preventative care while already paying over $1,600 a month for insurance. Do you see the trap here? Do you see how broken this is? Now, I know what some of you are thinking. She's self-employed. That's why it's so expensive. And yes, that's part of it. When you work for a larger employer, they often have group plans that cost less. JenX mentioned when she was a public school teacher, she had amazing healthcare, but the moment she left that job and had to get private insurance, everything changed. And here's the thing I need you to understand. More and more Americans are self-employed now. The gig economy, freelancing, small business ownership, that's the reality for millions of families. JenX said something that really hit me. She said for a long time, her family had no insurance at all, zero coverage. And she said, you're going to understand why in just a minute. And honestly, I do understand why. Because millions of Americans are making the same calculation right now. They're looking at paying nearly $20,000 a year in premiums, plus copays, plus deductibles, plus out-of-pocket costs, and they're betting they won't need that much medical care. They're gambling with their health because the system has made it financially impossible to do anything else. She mentioned they've had deductibles as high as $5,000, even $10,000 in the past. Think about that. Pay your premium every month, and then if something happens, you're still on the hook for $10,000 before insurance pays a penny. The monthly premiums might be lower with those higher deductibles, but you're still paying hundreds and hundreds of dollars every month with no real protection unless you have a catastrophic. Now, let me connect this to everything else I've been reporting on. Remember those 1,847 doctors I tracked who quit? Remember those 412 emergency rooms that closed? Remember when I investigated insurance companies abandoning entire regions? This is all the same crisis. It's all connected. Families can't afford care. Doctors can't afford to keep practicing under these conditions. Hospitals can't stay open when patients can't pay. Insurance companies are making record profits while coverage gets worse and costs go up. The entire system is collapsing, and the people paying the price are families just like JenX's, just like yours. I want to fact check what JenX shared because I don't just repeat information without verifying it. So I looked into current health insurance costs for 2025. According to recent data, the average family premium for employer-sponsored insurance is around $19,000 per year, with employees typically paying about $6,200 of that. But for people buying insurance on the private market, on the exchanges, costs are significantly higher and vary wildly by state and situation. JenX's numbers for a family of four with private insurance, nearly $20,000 a year in premiums. That's completely in line with what the data shows. Actually, in some states, it's even higher. In some areas, families are paying $25,000, $30,000 a year in premiums. The average deductible for a family plan is around $4,600, though plans range from around $1,700, like JenX has, to over $8,000. And copays of $25 to $35 for primary care visits are standard across most plans. So everything she reported checks out. These aren't inflated numbers. This is an exaggeration. This is the actual cost of healthcare in America right now. Here's what really gets me. JenX shared a story about posting on her main channel about going to the dermatologist for full body skin checks because she used tanning beds years ago. And new research shows that increases cancer risk way more than previously thought. She told her audience to please consider getting checked, but acknowledged it can be expensive and that some dermatologists offer payment plans. And someone from Canada commented that the thought of needing a payment plan for a full body cancer screening was absolutely wild to them. They couldn't even comprehend it. And that should tell you everything you need to know about where we are as a country. We've normalized medical payment plans. We've normalized going into debt for preventative care. We've normalized families choosing between paying rent and getting a cancer screening. We've normalized people gambling with their lives because they can't afford the healthcare system that's supposed to protect them. And I need to address something else JenX said that really resonated with me. She talked about how Canadians look at the US healthcare system from a Canadian perspective and Americans look at Canada's system from a US perspective. And you really can't fully understand unless you've lived it. She's absolutely right. I'm not here to tell you that any other country's system is perfect, but I am here to tell you that what we're doing in America is not working. When a middle-class family with no major health problems has to pay almost $20,000 a year and still gets hit with surprise bills for preventative care, the system is fundamentally broken. I've spent months investigating different pieces of this healthcare collapse, the doctor exodus, the hospital closures, the insurance company betrayals, but hearing the actual dollars and cents from a real family, seeing how it adds up month after month, that brings it all into sharp focus. This isn't just statistics and reports anymore. This is families making impossible choices every single day. JenX and her family are moving to Canada, and she's been documenting that process. And I'm not going to tell anyone whether they should stay or go. Yeah, that's a deeply personal decision. But what I will say is this: the fact that healthcare costs are driving families to consider leaving the country should be a national emergency. The fact that we've gotten to a point where paying $19,000 a year for insurance that still leaves you with thousands in out-of-pocket costs feels normal, That's a crisis, and it's getting worse, not better. Insurance rates went up again this year. Gen X's family saw their premium jump by over $230 a month. That's an extra $2,760 per year. And they're not alone. Millions of families just watch their premiums spike. And for what? Better coverage? More protection? No, for the same coverage that requires them to pay thousands out of pocket before it even kicks in. I want to circle back to something because it's important. Gen X mentioned her mammogram situation, and I want you to really think about what that means. Mammograms save lives. Catching breast cancer early dramatically improves outcomes. Dense breast tissue makes mammograms less effective. So I want to ask if follow-up ultrasounds are medically necessary. This isn't elective. This isn't cosmetic. This is life-saving preventative care. And the system is charging almost $400 out of pocket for it on top of nearly $20,000 in annual premiums. If that doesn't enrage you, I don't know what will. And here's what keeps me up at night. If this is happening to a family that can afford $19,000 a year in premiums, what's happening to families who can't? What's happening to the single parents working 2 jobs? What's happening to the elderly on fixed incomes? What's happening to the young adults just starting out? They're going without care. They're skipping screenings. They're ignoring symptoms. They're showing up to emergency rooms when it's too late because that's the only option left. This connects directly to the emergency room closures I reported on. When people can't afford preventative care, when they can't afford to see a doctor for $30 copays plus thousands in deductibles, they wait. They wait until it's an emergency. They show up at the ER, and hospitals have to treat them whether they can pay or not. But when insurance doesn't cover enough and patients can't afford the bills, hospitals lose money and eventually they close. 412 in 14 months. That's not a coincidence. That's a system eating itself alive. And the doctors quitting, 1,847 that I tracked personally. They're burning out dealing with insurance companies, denying necessary care. They're drowning in paperwork, fighting for their patients to get coverage for treatments that are clearly needed. They're watching patients skip medications because they can't afford the copays. They're seeing people die from preventable diseases because the insurance system made care inaccessible. And they're leaving medicine because they didn't sign up to watch people suffer while insurance companies profit. Everything is connected. The high premiums, the high deductibles, the surprise bills, the doctor shortage, the hospital closures, the insurance company profits. It's all one massive crisis, and families like Gen X's are caught in the middle trying to keep their loved ones healthy while the system extracts every dollar it can. Now, I want to give full credit to Gen X for sharing her story. Her channel is called JenX, and the video is titled, "What I Pay for U.S. Health Insurance, USA to Canada Immigration." Go watch it. She breaks down her experience with incredible honesty, and she talks about the emotional side of this to the stress, the uncertainty, the fear of, getting hit with unexpected bills. That's the part that doesn't show up in the numbers, but affects every decision families make. I've built this channel on investigating the facts, tracking the data, and exposing what's really happening in healthcare. And Gen X just handed me one of the clearest examples I've seen of how broken this system is. Her story isn't unique. It's not an outlier. It's the norm, and that should shake every single one of us. So here's what I need from you. Drop a comment right now and tell me your experience. What are you paying for insurance? What surprise bills have you gotten? Have you or someone you love skipped care because you couldn't afford it? I read every comment, and your stories matter. They build a full picture of what's happening across this country. Share this video. Seriously, share it with your family, your friends, your coworkers. People need to see the real numbers. They need to understand what's happening. The more people who know the truth, the harder it becomes for the system to keep exploiting us. And if you haven't subscribed yet, do it now. Hit that subscribe button and turn on notifications, because I'm not stopping. I'm going to keep investigating. I'm going to keep tracking. I'm going to keep exposing every angle of this healthcare collapse until something changes. I've already got my next investigation lined up, and trust me, you're going to want to see it. The healthcare system in America is failing families like Gen X's. It's failing families like yours. It's failing all of us. But the first step to fixing something is understanding exactly how broken it is. Now you know the numbers. Now you know the reality. The question is, what are we going to do? about it. I'm Helen Morland. This is the Morland Report, and I'll see you in the next one. Don't forget to comment, share, and subscribe. We're building something important here, and I need you in this fight with me.